What's up, everyone? My name is David Warren. Welcome back to my channel. Thank you so much for watching. I am a nurse practitioner, and I'm here today to talk to you about what it's like to be an acute care nurse practitioner. If you would, give this video a thumbs up. Consider subscribing. If you haven't seen my other videos, take a look. I am a family nurse practitioner, an acute care nurse practitioner, and an emergency nurse practitioner. Some of my other videos have talked about what it's like working in emergency medicine, but today I really want to talk to you about acute care nurse practitioner training, what the job is like, what school was like, and what kind of job opportunities you can expect. My setting looks just a little bit different than probably what you're used to. If you've seen my other videos, you know I work up in Alaska at times. And now it's Thanksgiving, the day after Thanksgiving, Black Friday, and I am obviously not shopping. I am home visiting my parents, and I am in one of probably my favorite places, and that's where we keep our race cars. So I don't really talk about my hobbies much on YouTube, but I love drag racing. And as you can see in the background, we have quite a few race cars here. I grew up racing and I still love it. It's something I love to do. And this venue for shooting is gonna have to work for now. So let's jump right into what it is like being an acute care nurse practitioner. But before we do that, if you saw my video that I posted yesterday, it was a little disheartening according to some, and I'm really sorry about that. That's not what I was going for. And I know that I talked about kind of the downsides of being a nurse practitioner, meaning the job outlook and the pay and lawsuits and not a lot of good enlightening things. And I'm sorry about that. That's not my intent. I don't want to be a Debbie Downer. I got 5 or 6 Instagram messages saying how I crushed some spirits, and I'm really sorry about that. That's not my intent. And for those of you who know me outside of this YouTube world, know that I'm not a negative person. And that was not my goal. I'm not trying to be negative. I wish there were things that I had known going into school, and those are some of the things that I wish I had known. And so at least in DFW, the job market is very tight. It's hard to get a job. I know new grads who have waited 1 to 2 years to get a job. Anyway, so I'm just apologizing for maybe if my video came across as negative. I didn't mean it that way. But I welcome the feedback nonetheless. So thanks for watching, and hope this video will be a little better. So let's talk about what it's like being an acute care nurse practitioner. So for my educational goals, I really wanted to work in emergency medicine to start with. And to do that, most people said you need family, you need acute care, and you need emergency. And so that's kind of the route I went. I did my family nurse practitioner first, and then I went back for an additional certification as an acute care nurse practitioner. And that's really what I want to focus on today. So first of all, my motives for going back. I went back because working in emergency medicine, you're expected to take care of critical acute care emergencies, obviously, in the emergency department. So I really thought, I need some sort of additional certification that will allow me that opportunity, because as a family nurse practitioner, you're good at taking care of primary care, urgent care type issues, but they don't teach you how to take care of septic shock and how to take care of a STEMI or a head bleed or some sort of major trauma in your family nurse practitioner program. And so people say, oh, you're technically practicing outside your scope of practice working in the ER as an FNP because you don't have the acute care training. Again, I hate how divided the nurse practitioner world is. You have to have a different certification for everywhere, but it is the reality of the situation. It is what it is. So that was the reason I went back for my acute care certification, so I could take care of the septic shock, the trauma, the head bleed, and have formal education on training me how to take care of those types of patients. So that was my primary motivating factor. An additional factor is, at some point, I really want to settle down and work probably in an inpatient ICU type setting. And the acute care nurse practitioner degree will allow you to do that. In fact, if you want to work inpatient medicine, ICU, anything inside the hospital except emergency department, I highly, highly recommend. In fact, I don't highly recommend it. You have to have that certification to work in an inpatient setting. You might scoot around it in some places, but ultimately, you need your acute care nurse practitioner certification if you want to work inpatient medicine or ICU medicine. It's just the reality of the situation. So I would highly recommend you do that. That was the main reason I went back, because I wanted the training in that. And the program was interesting. So I went to the University of Alabama, the Birmingham campus. It was a good program. I recommend it, actually. It was good. I learned a lot. I felt like the faculty cared and our clinicals were arranged. It was just it was a good overall program. And I felt like I learned a lot, and I felt like I met the goals that I really set forth for myself. And I passed my national certification on the first try, which ultimately is like the most important thing. You have to pass your certification exam. And so this program allowed me to do that. So breaking down kind of what it was like, the acute care nurse practitioner program is very intense. It is harder than a family nurse practitioner program. I've been through both, so I can kind of compare the two. You're gonna be focused more on inpatient medicine, ICU medicine, critical care. Mine was 2 years long, and ultimately you have to take like pharmacology, pathophysiology, physical assessment, all that. I took that my first go around with my family nurse practitioner degree. So once you go back for like additional certifications, you don't have to repeat those same core classes. Now you do have to take like the clinical courses and the didactic courses that teach you how to be an acute care nurse practitioner, but you don't have to take like the additional courses that you've already taken if you have another degree, if that makes sense. The program itself, again, was challenging. It's all like ICU critical care focused. I was a little disappointed in that regard, that I don't feel like it really prepared me to work in emergency medicine. So kind of a big letdown there. It prepared me for ICU medicine, honestly. Pulmonary critical care is like the main focus of the ACNP program. You're gonna learn vents like the back of your hand. You're gonna learn gases, drips, critical care medication, pathophysiology. You're gonna learn all of that. And again, you do get that in the emergency department, don't get me wrong, but the day-to-day management of vasopressors, of antibiotics, of following culture reports, of titrating ventilator settings, of like putting in a SWAN and reading the SWAN numbers and knowing what they mean. And like, you don't really get that in emergency medicine. You get a little bit of that. And again, it's useful, but to a lesser extent in the emergency department than it would be if you worked in a dedicated ICU. For you ICU nurses out there, all of that probably sounds very normal for you, because that's what you take care of on a daily basis. You titrate drips, you titrate vents, you try to extubate the patient, wean them off, whatever. I mean, I've never been an ICU nurse, but I've worked in the ICU in that capacity in my clinical rotations. So you know what it's like, and it's very much ICU focused. So in the emergency department, we're not like titrating vents on a day-to-day basis, because the patient hopefully gets bed. COVID time's a little different, they may be waiting, but on like a normal day-to-day clinical shift in the emergency department, you're not like titrating vents every day, gases. So it's a little bit of a disappointment in that regard, that it's not something that I found super useful, because I don't really practice that every single shift, if that makes sense. And I hope I'm getting my point across. If you want to work inpatient medicine, go the ACNP route. If you want to work emergency medicine, it's good. You learn a lot of critical care concepts, but you're going to forget a lot of that because you're not using it every single day. And that's kind of the problem that I ran into, is I remember all of the like ventilator settings and how to adjust things, but I don't use it every day, honestly. There are shifts that I don't put patients on vasopressors in the emergency department. It's just kind of the reality of the situation. Again, there are shifts that I do, but then there are shifts that I don't. So that's a little bit about the educational model for an acute care nurse practitioner. It's very intense on critical care, pharmacology, pathophysiology, drips and lines and vents, and if there's an orifice, put a tube in it. It's kind of the ICU model. So if that's your thing, go for it, if that's what you want to do. So kind of comes to the next point. If you want to work emergency medicine, you can go to the ACNP route. However, I would recommend going to an emergency medicine program. This is not what this video is about, so I'm just going to leave it there. Don't do ACNP if you want to do emergency medicine. Go to an emergency medicine program. If you want to work ICU or something like that, then go for it. Go to your acute care program. That's a little bit about what the education looks like for an acute care nurse practitioner. Let's talk about procedures. So in this certification for acute care, I did have a dedicated procedure course, and that was pretty cool. Now that did help a whole lot in emergency medicine because we are pretty procedure heavy in emergency medicine. Procedures that we do as acute care nurse practitioners, put in a central line. So in the IJ, in the subclavian, femoral, wherever you can put in a central line, we learned that. We learn arterial lines, putting in art lines, managing art lines, interpreting art lines, putting in chest tubes. What else do we do? Intubation, obviously airway management, endotracheal intubation. We did not learn nasotracheal intubation. We also did not learn to do crikes or surgical airways. I did pick that up in advanced trauma life support, but not something I learned in my acute care program. We did sedation, so with propofol, ketamine, etomidate, whatever other flavor of medication you want. We did learn sedations, fracture reduction, splinting, some of those basic acute care type concepts. Lumbar punctures, thoracentesis, Swan-Ganz line, pulmonary artery catheter, putting those in. Not something I will say that nurse practitioners do routinely, at least from what I can tell. I've never put in a Swan line on a real patient. Most of the time, I guess if you work in cardiothoracic ICU, you might float the Swan. I don't really know, to be honest with you. I've never worked in cardiac ICU, so I don't know. If you're a cardiac ICU nurse practitioner, message me. I want to hear from you. I want to talk to you. If you're an ICU nurse practitioner, message me. I want to talk to you. You got some cool stuff, I'm sure. So that's those are the procedures, those are the advanced procedures that I've learned in my acute care nurse practitioner course. And those have been pretty helpful in emergency medicine, especially the intubation, central line, art line, lumbar puncture, chest tubes, thoracentesis. I've never done a thoracentesis in the emergency department. Definitely an internal medicine or critical care thing. So don't expect to do that in the ER. So those are the procedures that I learned and that you can expect to learn. What are some topics that you'll learn about? So you will definitely learn how to read and interpret a 12-lead EKG. You'll learn cardiac physiology, pathophysiology, the management of acute coronary syndrome, the management of pulmonary embolus, management of aortic dissection. Really any acute critical care concept you're going to learn about. Oh my gosh, did we ever spend so much time on ARDS? Oh my word, I cannot even go on enough about that. Literally a whole week's worth of content for each semester dealt with pulmonary. All the pulmonary stuff, pulmonary function testing, ventilator management, management of ARDS, management of community-acquired pneumonia, hospital-acquired pneumonia, ventilator-associated pneumonia, all the antibiotics that go with all of that. I mean, if you work in the ICU and you know the physiology and the pathophysiology that you see in the ICU, you will learn about it. That kind of stuff made my head spin because we're not managing ARDS in the emergency department. That's a few days or a week after the patient gets to the unit. And thankfully, the critical care intensivists have to deal with that. So it was cool, but again, not something that I use because I don't work in that environment, if that makes sense. So those are a few of the topics that you pick up. It's pretty heavy on, again, the acute critical care stuff, hematology, DIC, ITP, TTP, all HIT, all of the thrombocytopenias that you will have to learn. Oh my gosh, all that brings back horrible memories. I made these spreadsheets in Excel. You'd have to compare and contrast all of these things, ITP versus TTP versus HIT versus DIC. And I had to go back and learn the clotting cascade. It's been Anatomy and Physiology 2 since I learned the clotting cascade, and fibrin going to fibrinogen, going to fibrin to prothromb. Factor 1 through whatever. Can't even tell you about that anymore. It's been so long. But yeah, you're going to learn all of that. So just have a good grasp on your physiology before you go in, and that will probably help you a lot. I'm having some nightmares now trying to go back to my acute care program. Those are some of the topics you're going to learn about. Settings in which acute care nurse practitioners work. So ICU is probably the main one. Most people that work in the ICU that are nurse practitioners have their acute care certification and take care of whatever comes through the door. So, there's sepsis, septic shock, MIs, fresh hearts, transplants, whatever flavor you work in, you're going to be taking care of that. So several of my colleagues work in intensive care medicine and absolutely love it. I'm sure it is a different vibe than the emergency department. And it's something that I would be interested in, which is one of the main reasons I went back for my acute care certification. But those are a few of the topics that you can expect to study in your acute care program. And then some of the jobs, ICU, hospitalist role, some specialty clinics will hire you, so cardiology, and most of that you will do like clinic plus call or clinic plus hospital rounding. Delving into the subspecialties, that's like super deep. But yeah, those are options, places that you can work. And I will say the job outlook looks much better for acute care nurse practitioners than it does for family nurse practitioners or any other flavor of nurse practitioner, because I really don't know why, honestly, but I've seen on Indeed lots of jobs for acute care nurse practitioners in DFW. Family nurse practitioners, a dime a dozen. Everybody, as I said in my last video, everybody and their mom and their dog wants to be a family nurse practitioner. And not everybody wants to be acute care nurse practitioner. The acute care nurse practitioner program, most programs require like 1 to 2 years of ICU or some sort of critical care experience. And before you start, most of the family nurse practitioners don't require experience because you're dealing with like pretty simple primary care type stuff. But a lot of the acute care programs require experience because you are, again, dealing with ICU level patients, and they want to know that you can take care of those patients, that you've done it before. So that's a little bit about the acute care nurse practitioner role, the program, what you can expect to learn, and kind of the job outlook. With that being said, I don't post regularly, and I really want to change that. I really want to get back into YouTube and like posting on a more consistent basis. And I've thought about some different ideas, and I kind of want to share a little bit of that with you about what I'm thinking. So I'm thinking about doing maybe some educational videos called like 5 Minute Friday, where we talk about like 5 minutes worth of whatever topic, sepsis, 12 lead EKGs, whatever you have in mind. And I would probably need your help on that to know like what content you might be interested in. So that being said, get a hold of me somehow. Instagram, email, comment below. Let me know kind of what topics you would be interested in hearing about, and maybe I can talk about them. And the other thing I was thinking is maybe I can do like some interviews. So you've heard my perspective on my YouTube channel quite a bit on all my videos, but maybe I could bring in like a PA or a doctor or another nurse practitioner and like interview them and kind of get their perspective. Maybe they are a little happier than I am. No, I'm just kidding. I'm happy. Maybe they have a different perspective than I do. If that's something you're interested in, get a hold of me somehow. Comment below. If you're interested in being on here and letting me interview you, if you're a nurse practitioner, comment below. I want to hear from you. All right. See you later. Thanks for watching.